Dana, I want you to help me understand a little bit more about the connection between our emotions and our health.
That's a great question, Bivi, and I think it's a question that's been answered already all across the globe for thousands of years. We have people that would practice yoga talking about that. Chinese medicine, everybody was using this connection in their healing journey. However, finally, the scientific world is catching up, and a couple of years ago, in mid-90s, there was a 10-year groundbreaking series study that was published in a British Journal of Psychology, that showed actually the stress and emotions. They're important risk factors or independent risk factors for pretty much any illness, including cancer. So that was an eye-opening event in the medical world, because from there, the scientific world tried to figure out or explain this connection, or what exactly happens when our body experiences a certain emotion, whether it's a happy one or anger or fear. And they discovered that actually there are actually some small molecules called peptide that will connect the thought with the physical body. And these are very small proteins that will eventually be a part of the hormones, including something like insulin, serotonin, which is the happy hormone, cortisol, and this is how a thought will be translated into a hormonal action. And from that, it's easy to see, or through that, it's easy to see how we can definitely see a wide range of physical or symptoms when we go through a certain emotion. So that's how, when you experience fear or sadness, you'll feel that either butterfly or that knot in your stomach through this certain chemicals and hormones that will circulate through the blood and through the neural pathways. And that's how finally we made that connection, and I think it's very important for everybody to understand that, whether they're the patients or their caregivers. We're all exposed to
and just
that
everyone,
stress.
not just cancer
just everyone,
patients,
of course, yes.
So
yes.
very interesting. So how can we balance our emotions?
I think you cannot talk about balancing emotions without talking about dealing with a high cortisol state and dealing with managing your stress level, because sometimes even a positive emotion can be stressful. And cortisol is just a very important hormone for our body. It is produced by the adrenal glands. These are two tiny glands that sit on top of our kidneys. But despite their small size, they can impact pretty much every cell in the body. And it's proven that a high cortisol state will eventually lead to a high, what we call sympathetic nervous system, high state. And that will just lead to a certain effect on your heart rate, on your blood pressure, on your breathing. It's easy to see here and understand how the cortisol will affect absolutely all of these organs, right? It will increase your blood sugar, which we know that's definitely a problem, because it will cause inflammation. It will affect your memory and attention and your capacity to actually focus and remember. A lot of patients, probably you heard them talk about this brain fog, and it's just when they're stressed, they also cannot remember. They go talk to their doctors, and after that they will just not remember things, because those emotions are so high that it just prevents them from functioning well. It can also here decrease the serotonin level. That's the happy hormone. That also helps out deal with anxiety and any, in general, any stressful thought.
So is that connected with like depression at all?
Yes, yeah, good point. Yes, it is connected, good point. And will definitely affect sensitivity to pain, which I think it's a very big problem for most patients, especially when you put somebody through treatments like surgery and medications, and we know they're going to have certain pain, but when you already have this, well, guess what? Unfortunately, their sensitivity is going to be higher, and they're going to need more medications and more interventions, and that cannot be good for obviously anybody.
Absolutely. So we can clearly see how and definitely the emotional impact of a cancer diagnosis is huge on a person. So we're trying to understand that it is important to treat the whole person. And you know, then when my mom was diagnosed with cancer, I not only the moment was so difficult to understand what type of cancer, what, you know, the options that she had, but then it was, for me, it was so important that she could deal with the emotional impact, that we could help her to lower that, you know, the stress and the anxiety that she was feeling. And then once we decided on treatments, the side effects of those treatments and how we were trying to help her. But I was, you know, and I think that's why we're doing this, because it was so important for me to transfer information and learn more from people like you that can help us understand how important it is to make our minds and bodies stronger. So thank you, Dr. Dana.
Thank you for having us.